Welcome to the K in Clarity podcast. I'm the host, Mezue. During this episode, we're joined by Anita Ballaney, founder of myHealthQ. Anita Ballaney has been instrumental in developing innovative care delivery models and digital health solutions within the healthcare technology space while being a leader in digital health strategy. Ballaney has been at the forefront of creating high-quality, affordable healthcare solutions that leverage technology to improve patient outcomes. Ballaney's expertise in health plans, benefits management, and population health strategies has allowed her to drive significant improvements in healthcare delivery. Her leadership roles at organizations like Elevance Health and her involvement with TAG Digital Health have positioned her as a thought leader in the digital health space, contributing to the transformation of healthcare through technology-driven innovations. In this conversation, we discuss her role as an advisor to small health companies, focusing on underserved populations and the challenges within the healthcare system. She emphasizes the need for transformation in healthcare, particularly regarding the third-party payment model, policy changes for innovation, and interoperability issues. Anita shares her personal journey in finding myHealthQ and highlights the importance of first principles thinking and hiring the right talent in healthcare organizations. As well in this conversation, Anita discusses the balance between being a subject matter expert and a leader, the challenges innovators face when attached to their ideas, and the importance of coaching and leadership. She addresses health inequities, emphasizing the need for a mindset shift and the role of technology in overcoming these barriers. The discussion also covers the future of data in healthcare, the positive potential of AI, and the critical importance of privacy and consent in healthcare innovation. Finally, Anita offers advice for founders to prioritize patient-centric approaches in their innovations. If this is your first time tuning in, here's the gist. The healthcare industry is buzzing with innovations, but there's a lot of noise and misconceptions out there. That's where we come in. Because of my experience in the healthcare ecosystem, I've gained a unique vantage point into the industry's inner workings. We're bringing you the conversations that typically happen behind boardrooms and strategy sessions, the real challenges, innovative solutions, and game-changing insights that are reshaping healthcare as we know it. On this podcast, we're bringing you face-to-face with the industry's leading healthcare founders, executives, and innovators. We're talking about the nitty-gritty of building and scaling healthcare companies, the hurdles they've overcome, and the strategies that have led to their success. More importantly, we dive into the personal challenges that come with trying to change a system as complex as U.S. healthcare. So whether you're a healthcare entrepreneur, a medical professional, or just someone passionate about the future of healthcare, this podcast is your backstage pass to the mind shape of the industry. Now let's have Anita tell us a little bit about herself. Welcome, Anita. Thanks for having you on. For the people listening, can you tell us a little bit about yourself and who you are?
Sure. First of all, thank you for having me here, and good morning to everybody who is listening. I am an advisor to small healthcare companies, health tech companies. My focus is product market fit and then kind of feeding into the product design. And more importantly, my market focus is the smaller segments, or what most people call the underserved population. And I have a slightly different description of them. It's basically, think of the smaller groups that don't fit into the scheme of the scale of the big companies. The big companies find these smaller segments difficult to serve. That's where I want to cut. That's where I play. And I work with companies that are also focused on the small businesses, the small healthcare organizations, small physician clinics that are trying to provide healthcare to the population. That's my focus.
Gotcha. Okay, perfect. So I know we're going to be talking about going forward in America, a little bit about product market fit for entrepreneurs, but we usually like to do an icebreaker here in the first question. So my first icebreaker for you is, if you could do anything to transform healthcare and wave it away with a magic wand, what would it be and how would it actually transform patient care?
So my funny answer would be get rid of all diseases. Right?
Okay.
If there were no diseases, we wouldn't have this dysfunctional industry. But
Gotcha.
I know your question is more realistic, like practical. We have diseases, and that's not going to happen.
Yeah.
So my answer would be get rid of this third-party, three-party payment model, right? Because today it creates a lot of waste. And when I say third-party, what I mean is there's a sponsor that pays for an individual's care. That's your employer, that can be Medicare, that can be Medicaid. And I'm not saying get rid of the safety net programs. I'm not saying get rid of Medicare or Medicaid. But the fact that we are tied to somebody else has to pay for my care, somebody else is allocating my healthcare dollars, that is creating a lot of dysfunctionality. And even more so, as care has evolved and gotten fragmented for the right reasons, we get a lot of specialization, we get very specific procedures, and that has gotten fragmented. But in this three-party system or three-party payment model, one has to go through back and forth for getting approvals, and it becomes, it basically fragments care. And so to your question, how would it transform patient care? It does a couple of things. First and foremost, the care becomes more continued, right? There are no starts and stops in care. It should change the patient or the people and the provider or the doctor's behavior. Now people will start taking accountability for their own care. They will be more responsible. I mean, these behaviors have to come through, right? Lifestyle changes may be required. And providers may also be more incentivized to take care of their patients as opposed to expecting a patient pool from the insurers, right? So right now this three-party system has created a lot of dysfunctionality and a lot of waste. When people say that there is a lot of waste in that 4-some trillion of our healthcare dollars, I believe it. I do believe there is 40 to 50% of redundant administrative waste in that. And I think that needs to change. So if I had to wave a wand and say, well, let's change that fundamental model. So, and we can talk about going forward how we can change it. And there are companies that are working towards it. It does require some regulatory changes, does require some policy changes, but hopefully we will get there. Hopefully, as the awareness of these dysfunctionality increases and people feel the pressure, we will change.
Gotcha.
I'm optimistic about the future. Okay. Always.
That's good. It's good to be an optimist. I believe in having the right perspective, right? It's going to push things along. I think, healthcare.
We have to.
Yeah. Yeah. I think with healthcare, it can be an industry, right, surrounded by so much. There's a lot of regulation. So, to innovate, it can be hard. And I think one thing that I've heard as advice is that you need to have the right type of patience. You have to have the right type of passion to actually care about everything and actually implementing that change.
Oh, absolutely.
I think my next question to you on that is, how do you see policy kind of making an impact in actually bringing that transformation as well?
So I think some of the things, and I think this may also go back to a couple of things. Today we have so many restrictions around what we can and we can't do, right? I think the biggest barrier some people talk about to innovation is, and I think there are a number of things. There's this whole security conversation, like can we share data, can we not share data? In the short term, I think if we ensure the right security protocols, ensure that the data is safe, and ensure that it's a patient opt-in versus being forced to share data, that would make a difference. And these would come from the policy perspective. And there are a handful of other things that we should go through, security protocols, etc. Definitely progressing so that data can be interchanged easily. Right, so we talk about interoperability as a policy, we talk about certain things. The other thing that I would say is hold the people who are accessing this data more accountable for the breaches. So ensure that if I'm giving my data to a certain company and they have a breach, there should be higher penalties. In the longer term, from a policy perspective, think about it this way. Today, our healthcare data is, the reason why we worry about keeping our data private is there's a lot of impact and stigma associated when somebody knows something about me that is personal, right? What if we remove that stigma, right? Or what if there was no impact? Today, there's this thought process that if an insurer knows I have certain genetic conditions, then I'm kind of that higher risk and my premium may go up. But with all the information that we have, those risks are really not risks. You just know and you have to care for it. What if we kind of eliminated that threat and that stigma associated with certain things? You wouldn't have these problems. And it's the same thing with addressing inequities. The reason why inequities exist are some group of people thought they are superior than the others. What if we got rid of all of that? And so from a policy perspective, when it comes to security, when it comes to certain restrictions on innovation, like you can do things, you can't do certain things, just remove those barriers. Let's just remove certain stigma. And improve the aspects that hold people accountable when there are breaches or the information is not being used in the way it is supposed to. Don't exploit that. Fix that part of the system versus shutting everything down. Like, put in the effort to hold people accountable. Make sure that our regulatory system or our law and order system holds the violators accountable versus shutting everything down, versus making it difficult for everybody. And I think that's where our policy should go, so that innovation, entrepreneurship is blooming in a safe environment and people can trust, right? And I think that's where we should be thinking about, as opposed to shutting everything down or requiring unnecessary reporting and we're creating more minutia as opposed to solving the issue of if somebody breaks the law, hold them accountable, let those penalties be high, but don't shut things down.
That's correct.
So that's how I would think about it.
Okay.
And be thoughtful and clever and crafty about that versus making it difficult for everybody.
I think another thing that you spoke upon was how interoperability plays a part in the data sharing. Has to be consent within the system and how people are actually receiving their data. Another thing that I had a discussion about with a leader is that there's a lot of difficulty with interoperability due to, particularly large health systems having, let's say, their EHR record being tailored to their specific hospital and their system. So it makes it harder to share data. And then also sometimes educating the patient themselves can be a little bit harder due to them not understanding all pieces of their own information. And so how do you think interoperability could potentially work in the future where, each system has their own EHR system?
So I think there are a number of standards that are coming into play, and I think TEFCA is one of them. There is another one, I forget the name, US something, which is essentially creating that common layer. So there are two things happening here. One is standardization, and it's not easy because I think interoperability itself has 5 or 6 layers. There's the lowest level is my code. Let's say in one EHR system, my code may be F for a female, but it may be 2 in another system, right? So there is that fundamental mapping. Then there's a layer of, are we interpreting the data in the same way? Do we have the same? So kind of creating that standardization and education around it has to happen. And I think a number of standards that are emerging are allowing that to happen, right? And then I kind of have lost the detail of technology because I've moved so much away from technology, but that is happening. I think where we are seeing challenges, and this has come about, it was talked about at a conference recently, is hey, a certain EHR vendor from Wisconsin does not open up their EHR for data. 2 things are going to happen there. One is either they'll be forced to open or people will find alternatives. The existing EHR systems are not perfect. There are about 600 or 700 systems. If not today, in a few years from now, they will be displaced. Large entities have been displaced. You can be the only game in the market for some time. As innovation is supported, as things happen, there will be an alternative. And there should be. And why not? So one of the things I would always say, anyways, and this might sound a little bit funny, but a lot of data in the legacy systems is anyway junk.
Wow.
Okay. So, we've talked about this bias in existing data. That data may not be as useful as we are made to believe. So why not with this new technology like IoT, etc., capture fresh data, and now with all the speed that we have, we may be able to collect data sooner. And with all the standards and with all the knowledge that we have now, we could find replacements. So I think, it's almost like fall in line, or you will be, what's the word for it? Obsolete, right? Things will move.
Yeah.
Right. So the more I personally do believe the more you try to hold on and try to control, the more it'll push people to find replacements and alternatives. And that's innovation.
Yeah.
Right. And that's what we need. So I would encourage all the innovators, I would encourage everybody like, hey, if you're not able to get past this, find an alternative. So I think we should think about it that way.
Okay. I like that. I think speaking about the challenges as well within the system, obviously I know you're the founder of myHealthQ. What inspired you to actually start that venture and address the challenges that you see within healthcare?
I ask a lot of questions. I'm one of those people who learns by question. The complexity of, so this is a slightly long-drawn story, but the complexity of the US system hit me in two installments. The first was a project that I did for one of the retail pharmacy chains, and they also had a PBM, and that was a time when Medicare Modernization Act was being implemented, and I was blown out of my mind how complicated it was for people to get access to their prescription medication, and this whole concept of a donut hole in Medicare. I don't know if you know what that means, but it's stupid. At the end of it, it's just the way it works. I'm sorry. And so at that time, I just kept asking a whole bunch of questions to the client and my colleagues, and just didn't resonate with me, because I came from a country where prescription medication was very easily available, and up until the first 10 years of my life in this country, I would always go back home, talk to my family doctor, which happened to be my father, get everything taken care of, come back, and I was fine, right? So that was my first introduction. That's when I decided to make healthcare my home industry. Like this is the industry I wanted to work in. The second episode came soon after that, when I myself had to go through certain tests in this country. My PCP ran some tests, and she says, we need to do something again. Okay, we do those tests again. And then she says, I need to send you to a specialist. Okay. She sends me to the specialist. The specialist runs the same set of tests again. And I start asking questions. Why do you have to do these tests again when she's already done it? Why can't you use the same results? And the specialist goes, nope, I need to do it on my equipment. And there's a whole series of things that I go through which to me felt completely unnecessary. And at the end of it, there was a diagnostic biopsy that I went through. And then I find out that a vast majority of certain biopsies are not needed. It was a positive, like I think they call them a negative outcome, which means I was fine. And there are false alarms. Like America has a whole bunch of more false alarms. And that's when I started asking questions like, why do we have to do all of this? And the more questions I asked, the answers that I got raised more questions. At the end of it, the answer always ended up being, oh, it'll take an act of Congress to change certain things. And so, fast forward a number of years, by then had worked with Medicare, Medicaid, all physician practices, the insurer, etc. And the idea of myHealthQ was helping people answer questions about their healthcare, and those questions change as they go from one stage of a condition to another. And the ultimate idea is to be able to solve problems with thoughtful questions. And as a business, I say we will leverage policy, a business mindset, and technology to thoughtfully solve those problems for the people who need it. Right? Like address the inequities, or address policy issues, or leverage policy. In some cases, there are favorable policies that we should use to be able to solve problems. And so it's more of a questions-based approach, help people answer their questions in a simple, easy to understand way, and guide them through their care process. They have long ways to go. This is just the beginning. But I think it's important that people have questions. And we should encourage people to ask questions.
Absolutely.
That's the mindset.
Yeah. No, that makes sense to me. I think with what you've kind of spoken about as well, we touched on it a little bit more, but I wanted to see if you could go a little bit more in depth is dysfunction in the process of healthcare and also how things play a part. I call it kind of the middleman problem. I think it's necessary to have some middlemen within the system. It helps provide some efficiency, but also the sharing of information, all the other burdensome costs can actually be a detriment to the system. So how do these things actually get resolved from what you can be?
So the answer is a little bit more complicated. In today, what has happened is the insurance carriers, and the same concept is for the pharmacy benefits management, they have become the two key intermediaries for information exchange. If you think about the original role of an insurance carrier, they manage risk, they paid claims, and they created the networks, because the provider networks, the care networks. And so, it made it easy for the employers to say, hey, you can either take the risk or the employer takes the risk and my employees will get access. And then the same thing happened, pharmacy, as the life sciences evolved and we had more drugs, we had more medication happening, or these drugs and devices being available, we needed specialists to be able to prescribe drugs for certain conditions, etc. And the cost of care, historically with medications, the total cost of care decreases as opposed to the medical care, and that's this entire model. Over time, these same companies are processing the safety net programs. They are administering the Medicare, Medicaid programs. And then now they're also administering or helping with the whole social determinants. This is my kind of theory or hypothesis at this point. I think these need to get separated, right? So the reason safety net programs have been are sitting with the carriers are because they have the infrastructure, right? And there are a number of reasons. But I go back to, let's solve the root cause, or let's solve the problem, as opposed to just creating bandages and, like layering one problem. To solve one problem, we create bandages, we do certain things, and then it creates more problems. So I think we need to step back and go back to why was health insurance originally needed, right? It was to manage the financial risk of high cost of care. Stick to that, right? We need the safety net programs to help with situations where people need that care or people need help. Not everybody's equal. We need those safety net programs. Don't burden two different or three or four different types of risks and pool them, because what it has done is increased everybody's premiums. It has increased cost of care. It hasn't solved the problem. So to answer your question, what should be done, I think we really need to separate things out and focus on what is the problem that we are trying to solve, as opposed to mixing all the problems, right? Right now it's become a hodgepodge and a patchwork of solutions where you fix something and you create other problems. And you also incentivize waste. Fraud, waste, and abuse kind of starts creeping in, because if something is available, I'm going to take it. That's human nature, right? So I think things need to be separated out and go back to the intent, and let's solve the real problems. Like why certain things were needed.
Okay. I think with at least what you're speaking about right here, it kind of reminds me of first principles thinking, right? Why is this thing in place? Is there anything that we can reduce, right? And so I guess what would be your advice for, founders, executives, leaders, to kind of implement first principles thinking and also being strategic in the way that they can actually solve problems within health?
So I have a handful of things I would say. When you think of strategy, my core mindset always is, what problem are we trying to solve? Why are we trying to solve it? What's the impact? Like, how many people does it impact? What's the solution? And how will we test the solution works? And then I learned two other things. These were two insights that I gained at Elevance, and one was stop admiring the problem. So stop dwelling on, and I really internalized this and used it during the tag signature event, making sure that we invited people on the panel and in the showcase companies that had solved the problem. The second principle was fast fail, right? Fail fast, which is the idea of trial and error. Now this does not come easy to me. Trial and error does not come easy to me. I have to know the root cause and start solving. But in reality, we do need all three at the same time, because it's a balance. Because there are certain problems, if we try to wait for the root cause, if we try to wait to figure out the root cause and solve the whole problem, there will be more damage done, right? The pandemic, the virus was exactly an example of that. If we had waited for the vaccine before we did anything, we probably would have lost more lives, right? So the shutdowns, the social distancing were to help mitigate the worsening of the problem. So we do need that balance. So from a strategy perspective, my insights to leaders would be definitely understand what problem are we trying to solve, why are we solving it, what's the impact, make sure there's a balance, and then kind of going forward, I would say keep an open mind. Be aware of all the innovative things that are happening around you, but don't fall into this trap of fear of missing out. Just because Elon Musk says we should do something, don't do it. Do it if it's right for you. Do that due diligence. Assess how it applies for your customer base, for your patient base. If it fits in your portfolio, if it aligns with your company's values, if it aligns with your strategy, then do it. So don't just do it because it's a fad. Now that does require that your innovation budget have some amount of capacity for due diligence, some amount of capacity for having that awareness, and not all companies have that luxury. But I would definitely say think of it in a way that it's right for your stakeholders. Don't do it because everybody else is doing it. Mm-hmm. So that's kind of a handful of things that I would advise leaders as they think about innovation, as they think about strategies, right? Those would be, and hire the right people. Make sure that your teams are representative of your clients or your customers or your patients, right? They'll give you that perspective and they'll tell you what's important to them, right? I'm by no means suggesting you should have affirmative action. That's not what I'm suggesting. What I'm saying is bring the diverse inputs, but do the due diligence before just jumping to action. Right? So yes, you can have bias to action. Yes, you must not be obsessing on the problem. Don't admire the problem, but have that due diligence. So to me, testing whether something's going to work or not, it requires that discipline, and you should have it.
Okay.
You need to have that discipline.
I think with one thing that you spoke as well about, talent and hiring the right people, I think that can take you so far as a company. How should, healthcare leaders and founders really find the right people that actually have healthcare experience? And is that even a factor that's important in going into healthcare in different aspects of building out that team? How much should that person know about health? Should they be really domain specific in solving those problems? What do you kind of think about that? And where do you find these people?
So some roles need to have domain-specific knowledge, others don't. And then depending on the level of the role, the mix matters. As you think of hiring senior people, it's the mindset of the person that you need to think through. Does this person have the maturity? Is this open? Can this person collaborate? Can this person bring people together? Can this person be innovative? And the leader does not have to be the smartest person in the room. But when it comes to people who have to do the due diligence, they have to have that subject matter expertise. So there are certain roles that will require the depth of expertise, and in my opinion, that's non-negotiable. So it depends on what is the job to be done, knowing what skill sets are needed, and therefore you must hire the people with that experience. Now, there are people who say, we want somebody from the outside to be able to do something. We want a fresh perspective. Yes and no. I've gone through both. I've worked with both types of leaders where, leaders who have not been from the healthcare industry, but they've had a very mature mindset to let the person who knows do their job and give them the cover. Right? right? So, and then there are others who are, oh, I don't care how this works. This is the reason why this industry was broken. You have to do it differently, and it doesn't work, right? So I don't think there is a cookie cutter answer to that question. It is really finding those people with that good judgment and depending on the role. And then I have also come across people who at a certain level are very detailed subject matter experts, but as they have grown, they've expanded their horizon and have been able to take on, and they become great leaders, right? So, and there are others who prefer to be that subject matter expert, and they create the domain and they become people known in their vertical, in that specific area. And that's success too. Not everybody needs to be successful as a people manager, and not everybody needs to be or would be successful as a subject matter expert. Just figure out that balance. You know, it works both ways. How do you hire people? Depends on what your need is. And do they have a path? And you figure out what their path is. And I think that mindset is kind of fading away in the corporate world. I personally think so. And I think that's the way to think about people and teams and organizations. And we are at a point in the professional lives or the scale of things. It's never going to be a one-person team. It's always going to be a team effort. And so just figure out, who that team is, and can you make things happen with that group of people.
Okay. I think another thing that you spoke upon before that kind of had me thinking is that, sometimes a lot of leaders and founders can kind of fall in love with the idea. So what do you see as, the failure points that sometimes happens to founders and leaders when they're trying to innovate and actually provide the right type of strategies to solve problems? What do you think that usually is, and what do you usually see?
There are different ways, and I'm actually currently, I think, experiencing a founder who has a very preset way of thinking about their. One is kind of show them the potential of the innovation, right? A lot of time, you have to speak their language. A lot of time, innovators do things because they want to make a difference, and they believe they have found the way how to make a difference. Now, going forward, either that specific idea will definitely scale and make an impact to a larger population. Show them that path. There are times when there may be a competing idea that can threaten the existence of this innovative idea, right? Kind of explaining that, hey, look, if you choose a certain path, you can make the impact that you created the idea or the innovation for. Kind of touching that is what matters, So it's essentially being able to show them the value of their innovation and how far it can go, and what are some of the threats, and if they don't do certain things, it may not have the impact that they visioned for, right? So I think that's important. In most cases, you have to connect with the person who owns something, because there is that pride of having done something, right? You have to respect that. You have to appreciate that, and it's their baby. Kind of have to show them how big, beautiful, or what impact that can have, and bring them on board.
With what you've kind of seen in your time with working with startups as well, how has that, or can you share any example of your coaching leadership style and how that's actually had another influence on leaders and actually bringing about the changes as well in healthcare?
So there are a handful of things that I go through. In the startups case, and I haven't had experience with hundreds of startups, it's probably 10, 15 where I've really engaged with them. A number of them are looking for education on the US healthcare industry. They are working with a health tech product. They believe that that product will work for the entire 330 million or 340 or 350 million Americans. And I'm like, no, it won't. Remember, we had this conversation, right? Who's going to pay for it? And how do insurers pay for it, what segments they do. And so very quickly that 350 million number drops down to 10, 12 million or even lower. And they appreciate that. So that just that basic education works. In other areas, I've come across a situation, and this is less of startup and more of the big corporate scenario, where this young individual gets promoted to a leadership role, and they have inherited a contract that they need to, that, has been approved by their boss, has been approved, this is the solution, they're going with this vendor, and all they have to do is execute it. And at that time, my role was more from an enterprise. I had a handful of 10, 12 different programs, projects going on. And this person comes up to me and says, I don't think we should spend this money. And so we sit down and talk through why. And this person goes, but I don't know how to say this because my boss has already made the decision. And they had all the data points. So it was just a matter of, okay, let's package it, give them the confidence, and go talk to their boss. And the vice president understood. They made a different decision. The point being, at that time, it was more about just giving confidence to the individual, right? So coming back to leadership styles, and some of it is, just providing information. It's educational. Some of it is just helping build confidence. Like some people just need that assurance that, am I on the right track? And then I've had and this is where a number of young women, like, hey, in this gender biased world, especially in industries such as management consulting or technology, which are very male dominated and work in a certain way, how do you overcome certain barriers? And again, there it's a lot of kind of building that self-assurance. You got this, right? A number of these are more soft skill type, help build confidence, just share information, confirm, and that helps. So there you go.
Thanks. I think another thing I wanted to touch on as well is, what do you see as the significant barriers to health equity, and how do you think people can actually solve them?
So I think the significant barriers to health inequities are the root cause of those inequities itself, which is where it's unfortunate to say this, but a group of humans believe they are superior than another group of humans. I mean, that's really the root cause of inequity. Right? Someone believes, their fairer skin is better than the darker skin, or the male is more superior than the female, or in global cultures, a certain caste is better than the other. I think these are man-made inequities. So how do we think we are going to overcome these barriers? Fundamentally, I think we have to keep changing that mindset. Right? But that can't happen overnight. Where I do believe that going forward, there are 2 or 3 things that are starting to happen. One is, I'll go from kind of the cultural human to the technology part of it. So and I'll, keep myself to the US domain, right? Just within this country. But as the population of our country becomes more global, multicultural, some of those barriers are going to start decreasing, right? Because people are going to start appreciating and, be open. So that openness is going to come in. More tactically, here's where I believe technology, digital health, AI, ML will start helping or tackling these issues. Like I said, the legacy data collection is junk and full of biases. And so the algorithms that are running today are running on either junk or biased data. But in the future, as data collection moves towards more of these IoT-based devices or automated, I do believe that bias in the original data collection, the input itself, is going to go away.
Okay.
And once that data becomes unbiased, everything that's running on it and everything that we are responding to will maybe start changing, right? That's my thesis. That's my optimist. That's the optimist in me talking, right? Because a lot of the inequity and the bias that's coming is from that legacy thought process that did make its way into the data collection, that did make its way, and that's what, the AI algorithms are using, and therefore there's that bias. But as new data starts coming in that's unbiased, then it'll change the mix, and I can hope that the future will be unbiased, right? Those inequities would go away. That's my hope. And hopefully, as mindsets change, as populations become more global and multicultural, I see that opening.
What do you think the data collection, how is that going to change, and why do you think that's going to change, and who's going to be actually bringing about that? Is that a founder, or is that a certain organization?
All of us.
How do you?
No, it's
Okay.
going to be, so the IoT devices. So let me give you a very specific example. Historically, when people are filling out forms, or when people were filling out certain paperwork, the person helping fill the paperwork out had an influence on what they were writing, right? Today, I can go, my input to the data is, hey, I can put everything on a screen. There are a number of times where we're using scanners and IoT devices. The blood that we're collecting from our glucose meters, etc. All of that is becoming automated. Everything that we're collecting, whether it's through forms, screens, scanners, is becoming automated. Historically, when that paperwork was being collected manually, the paperwork could get lost, or depending on what was captured in that paper, there was that potential for human bias. But as we start moving towards devices collecting the data, it's just capturing data. It is what it is. It's not going to say, oh, this was collected from a black person or a white person or a male or a female. This is it, right? So I genuinely think that, and it's going to come from the innovators, it's going to come from the founders, it's going to come from, and that's what I meant, right? That today EHRs have a certain role and they are capturing information there, but if an alternate comes out, then we will change the game, right? So I do believe that there's a way to go to the source.
And what else do you think maybe an EHR solution could look like in the future that will really help tackle those problems that's different than what's today on the market?
Oh boy. An open EHR, right? So think of what an EHR system does today. It's collecting all of the patient's data. It's helping with clinical decision making. And then it's, at some point, it is feeding the intelligence systems or diagnostic systems. That's essentially what EHR systems are doing. And then they won't like to hear this, but they're helping with revenue cycle. They're helping with billing. That part of it is the most administrative and the most trivial part of it. The value right now that everybody's after in the EHR system is the clinical data that it's collecting. There are so many mechanisms to, and that was actually my first startup idea, that if I could take that clinical information about me out of the EHR and centralize it with myself and give it to whoever I want it changes the game, right? Then all that the EHR is doing is administrative, revenue cycle, claims, billing, etc., right? But there are companies that are now starting to kind of change that. Hey, there's the care coordination, there's the pathway that requires a patient's information from different lab tests and things done. If I remove that from the EHR and make it available in a different repository that can be accessible, that changes the game, right? So I think we can think about it differently.
I also want to touch on in AI and what your thoughts are with AI. Do you think it's a positive, it's a negative? What do you think its future impacts are going to be? And just get your general thoughts from there.
I think it's a positive in the bigger scheme of things, because think of what AI and machine learning are doing. It's providing that very complicated computing power and the algorithm. So AI by itself has many definitions, but if I was just to kind of frame it around its intelligent computing with machine learning, etc., I think that's very powerful, especially when combined with IoT, 3D, telecommunications. It becomes very powerful, right? Where we need to be mindful of, and this goes back to that first point, which is hold innovators and the companies that are collecting our data accountable for right use of that data, right? Prevent the abuse of innovation, put those things in place, then it becomes far more fruitful and productive for the humankind. Everything has a positive and a negative. Let's figure out a way to curb the negative or control that or prevent that from harming and leverage the positive or use. Because it's amazing what we have been able to do with AI. With the algorithms and with the computing power, and it's fascinating. It definitely is. But at the same time, we have to discourage the abuse. And this is true even about what we were talking earlier, the three-party system or the data security. Hold the people who are breaching their contracts accountable, right? Prevent that data abuse. Make sure that the people, and even hold the innovators, like when people are innovating products, make sure they're thinking of, how could this be abused and how do we prevent that abuse, right? Can we do it 100%? Hell no. Human nature will be human nature. There will be the tendency to take advantage of things.
Correct.
But then we also can protect ourselves. So it's, again, we have to ensure that the penalties for, at least the stakes are high.
Okay. Following that thought process, I guess, how do you see the balancing of innovation while also interacting with privacy and security in healthcare?
It goes back to the point, which is, we need to make sure that my information that I share with any company, an innovator, is used correctly, right? So make sure you have my consent, make sure it's an opt-in versus opt-out, right? So, and opt-in doesn't mean that if I don't agree to it, you're not going to service me. So a lot of the opt-in forms today that you sign or agreements that you sign, if you don't agree to do certain things, they don't give you the service. That's not consent. That is, you're forcing me. That's not a voluntary consent. The point is, I should have access to a service and also have the right to say, but don't use my information for something else or anything else, right? Today, that's not the situation. Today, if you go in for a service, you're blanket giving away the permission to share your information. And that's not the way it should be. And so as people are thinking through their programs, as they're thinking through certain things and they're collecting people's information, then the individual should have the right to say that you're not allowed to use my information for anything else. But that doesn't mean deny me service, because that doesn't work. And in the longer term, I go back to, if we start removing the stigma out of certain breaches, or as an example, and this is something people are afraid of, if an individual has a certain high cost condition, does it affect their employment? Because right now employment is, an insurance is based on employment. And because it's increasing the cost for the company, depending on the situation, will they not hire me? And this goes back to that whole third party relationship, right? Who's paying for the care? And I think we need to break that, because that's creating so many barriers, and it's stifling a whole bunch of things.
I wanted to understand a little bit more about data sharing. I think, why do you think that system wasn't built in that type of way to allow for service as well with the openness of data? And what do you think that feature could look like in the system as well?
So it becomes expensive the reality is, the more options we give to people, the more expensive it becomes to develop, because every time, and this is how tactical it gets. If my program is processing for only one option and it's going to just keep, I got this information, I have the consent, I can do whatever with it. But the minute I say, no, I have 3 conditions that I have to take care for, I know my programming increased, right? So when it comes to this whole consent, etc., I think a number of reasons why companies force certain things is it becomes standard. It becomes standardized, cheaper and easier for them to process. And that's where I go. Like, I think people just try to take the easy way out versus actually understanding the situation of the person, versus really giving the flexibility. Everything is being boxed into, it's standardized. This is the way you're going to be, right? And this is the way it's going to get processed for everybody. And there's a loss of choice and freedom. So, yeah. That's kind of what goes behind the scenes.
And going from there, how do you advise founders with your leadership style as well to take the hard route, to continue to push? And where can they also find the right information to help work on those decisions and actually cater the right type of insights to allow them to make the right choices as well?
So my advice to founders would always be understand the situation of your patient if they are working on digital health tools that are working towards their patients, right? Understand their situation, understand that experience and incorporate it, right? Ensure that that journey that your patient will take on with your product is really about the patient and not about your product. Now, the question is, where will they find that information? It's a combination of things. This is where it does become challenging. Sometimes it is, hey, you're going to need primary research. Sometimes it is buying databases. And again, it's not always easy. And sometimes, and this is where fail fast, this is where that method now hits, is keep trying. Right? Do your trial and error, collect the data and evolve. But have that nimbleness and agility and have patience. And the core advice would be do the right thing for your patient. So understand their situation or understand that member's situation and incorporate it. Don't create or design a product because you're going to go sell it to an insurance company and it's going to make you money. And that can be done in many scenarios. And I'm not saying that's not the right exit strategy. Do it for the beneficiary. Do the right thing for the patient, and you'll automatically find the way to move ahead. It's harder, but it's very fulfilling.
I love that.
And that's where kind of my tagline comes in. Being human is our greatest strength. Right? Keep that humanness in you, and that'll show you the way. That is our greatest strength.
But now it's time for the lightning round. So I'm going to ask you one of the first 3 questions, okay? So focusing on innovators, people that are being the change makers, who's a healthcare innovator in the past that has motivated you, and what did they actually do, and why are they so important, and what do you think that healthcare leaders can actually take away from them?
So I think I'm actually going to go back to a discovery that happened, I think, many decades ago, and that has kind of changed the game. There are 2 people. There is Alexander Fleming, the inventor of penicillin, and then W.T. Morgan, the guy who created or discovered or made the best use of anesthesia. And why? Because these are 2 discoveries that have created the longevity and have allowed people to survive through painful surgeries, right? If we didn't have that, I don't think our industry would have existed. Right? Again, people would, we wouldn't have been able to take care of the infections. We wouldn't have been able to do complicated surgeries. We wouldn't have been able to do a number of things. So I think and why would I want to meet with them? It's just inspiring. Like, what was the mindset? What was the thought process? And what went into that process? I think, to me, those are 2 folks I would love to meet.
Focusing on from there, what's been a skill that you've utilized in your career that has been underrated and you think others can take from that as well?
Testing. So I started my career as a programmer, a software programmer. And that's a kind of testing whether my solution will work. I've always tested whether a strategy will work, kind of that problem solving, right? Why are we trying to solve the problem? Great. What's the impact? I know it. Will my solution work for all impacted, right? So I think testing is the most underrated skill, and it's not about the programmatic testing. It's even about the operational decisions we make. It's even about the strategies we make, right? So I think that's a very underrated skill.
Okay. And then a last fun one is, if you could, speak to a time traveler from 100 years ago, what would you tell them about the healthcare advancements you work with today, and the impact that it's made?
What would I tell them about I would just basically say the way I would describe the advancements that I'm working with. And remember, I work more on the operations and the product, etc. side. The best way I would think about them is, hey, we are doing things to provide the right care at the right time in the most effective and the efficient way. So it's a lot of with the questions and everything, is a lot of coaching. What I do, like my work is more about orchestrating so that things work. So I'm more of behind the scenes person and a coach that basically figures out what plays to make and make things happen. So think of my job and think of what I do as applying the advancements as opposed to being part, like having innovated something. I'm more like, how do I apply it and make it work, right? So the usefulness of it is what I would describe my job and role as. Like, hey, just use it, just make it work.
Okay. Perfect. Thank you very much, Anita, for your time on the K in Clarity podcast. What are some final thoughts that you want to leave with the audience?
Keep innovating, because that will help us all. And I will quote a corny line from, oh my God, I forget this guy's name, but essentially, listen to that heartbeat, listen to your whisper in your hearts that's encouraging you to innovate. Keep doing it, put your life in it, and we all will benefit from it. So thank you for innovating. Keep doing it. We will all benefit from it.
That's perfect. Some perfect words. For the audience as well, where can they find you and follow your content?
So I am on LinkedIn, and my email is my first and last name, Anita Ballaney at myHealthQ.
Okay. That's perfect. Thank you again for your time on the K in Clarity podcast.
Thank you so much. I enjoyed this conversation. Thank you.
Likewise. Bye.
Bye.